Hello anatomy students. On to another short video that will discuss muscles of the abdomen. Our first muscle is going to be the external oblique. Again, with this torso model, superficial muscles are on the left side and deep muscles are on the right side of your screen. First, I want to show you the external oblique, which I will highlight. Again, when you're looking at your screen, this is on your left. In the anatomical position, of course, it would be on the model's right. But here is our external oblique. And it's oblique because we could see the fascicles, the striations of the muscle going in a slanted fashion. The external oblique has its origin on the lower 8 ribs. It inserts on the iliac, the pubic crest, and the linea alba. So the iliac also has a crest, remember. So iliac and pubic crests and the linea alba. Its action is to flex and rotate your trunk. Another way of saying that is flexion at the hip. We use our external oblique when we are doing sit-ups. And if you do a sit-up but also twist your torso, you are definitely using your external oblique. So again, its origin, the lower 8 ribs. Its insertion is on the iliac and pubic crests and the linea alba. Perhaps we should go back and explain, or have me explain, what the linea alba is. The linea alba is this piece of connective tissue, this white line going down the center of the torso model. It is not a muscle. It is connective tissue. So that is one of the insertions. It's the linea alba. Moving on to our internal oblique. Now, for the internal oblique, we have to look on the deep side. On the deep side of this torso model. And shown here, I'm highlighting, we can see the internal oblique. It's deep to the external. So we see all of this fascia has been moved away. So that's away, that's no longer there, and we're now looking at the deep side. The internal oblique has its origin on the lumbar fascia, the inguinal ligament, and iliac crest. Its insertion is the linea alba and pubic crest. And the lower 4 ribs. Sorry about that, I got distracted. So let me say that again for the internal oblique. Its origin is the lumbar fascia, the inguinal ligament, the iliac crest. Its insertion is the lower 4 ribs, pubic crest, and linea alba. Sorry if I misspoke earlier. Its action is to flex and rotate at the hip. So again, it's going to flex your trunk. You're doing a sit-up, but also allows you to rotate your trunk. Going back to our picture, we can see that the origin would be coming back here from the lumbar fascia. Here is the inguinal ligament. Down here, I'm showing it in blue now. And we also see the iliac crest. So all of this area would be the origin side. The insertion portion would be the lower 4 ribs over here. The pubic crest down here. And ultimately to the linea alba. It doesn't look like it reaches the linea alba because a lot of that fascia that would be part of the muscle protecting it, overlaying it, has been removed from the muscle in order to see it deeper underneath the fascia. Moving on to the rectus abdominis. The rectus abdominis, again, is underneath this fascia. We can see it kind of peeking through the fascia. But if we look at the deep side of our torso model, we can see the parallel striations of the rectus abdominis, and that's why it's called rectus, which means straight. Again, here's our linea alba, the white connective tissue in the middle, and then in between the portions of the rectus abdominis, we see these white lines, and those are called tendinous intersections. So tendinous intersections in between those portions of the rectus abdominis. And when you work out your abdominal muscles, you're always trying to get your six-pack, correct? Well, that's because you're building up the muscle in between those tendinous intersections. The rectus abdominis has its origin on the pubic crest and pubic symphysis. It inserts on the costal cartilage of ribs 5 through 7 and the xiphoid process. So it's weird for students to think that the origin is down here and the insertion is actually up here in your chest region. Now, the rectus abdominis can also be seen on this cadaver model here. We can see the rectus abdominis in between those tendinous intersections. Again, the origin down here at the pubic crest and pubic symphysis, insertion up towards the chest, the costal cartilage of ribs 5 through 7, and the xiphoid process. Its job, like the external oblique and internal oblique, is also to help with flexion of the trunk and rotation. Here is another picture of the human cadaver, and we can see the rectus abdominis. I'm just going to abbreviate. We can see the external oblique going with the fascicles, hands in pocket kind of fashion. External oblique. And then we can also see the linea alba very clearly on this picture, and the tendinous intersections. Moving on to the transversus abdominis. The transversus abdominis is actually the most deep of your abdominal muscles. So I need you to count layers. This layer here is your external oblique. The next layer has two muscles. It has your internal oblique, and it also has your rectus abdominis. So notice, here's another cutout window. That one is the internal oblique. And then here's the rectus abdominis. And then the deepest one is your transversus abdominis, shown here with the green question mark. 4 muscles of your abdominal region, 4 muscles that I just covered, that are arranged in layers or sheets of 3. The external oblique is the most superficial. Deep to it, we find 2 muscles, the internal oblique and the rectus abdominis. The deepest muscle is your transversus abdominis. Shown on our torso model that you've seen in previous pictures, I actually need to flip the model around to show you the transverse horizontal striations of the transverse abdominis. So it's on the underside of the chest plate for the dorsal model man, as we like to say. Again, this is the underside that we're seeing. To go back up, this torso model, just to highlight it in blue, this torso model, all of this section can come off of the model, and I can turn it around to show you the underside. And again, we can see the linea alba with the horizontal transverse striations. Its origin is the iliac crest, cartilage of the lower 6 ribs. Its insertion is the linea alba and the pubic crest. Its action is to compress your abdomen. When you are defecating, you oftentimes use your transversus abdominis to help expel the fecal contents. The last muscle that will be discussed in this short video is the diaphragm. There are several models that we have in the lab that show the diaphragm. First of all, 2 good examples are our lung models. And you can see here that the diaphragm has this dome-shaped appearance. It is skeletal muscle. That means it is voluntary muscle. And it is the anatomical boundary between the thoracic region and the abdominal region. And again, we can see the dome-shaped appearance of the diaphragm here. It has a part that actually is attaching to the sternum. It has parts that are attaching towards the ribs, so the cartilages of the lowest ribs and towards the sternum. The cartilages of the lowest ribs are the origin, and also lumbar vertebrae. We can see it all the way in the back here attached to a lumbar vertebra. Its insertion is this central tendon. So it says costal part of diaphragm. I'm going to change that just to read for the insertion central tendon, and it looks all white, right? Tendons are made of connective tissue and they have a white appearance. So that's the central tendon. And the reason why the central tendon would actually be up towards your ribs, costal region, is because when the diaphragm is relaxed, it actually is domed up superiorly. So when the diaphragm is relaxed, it's like this in your thoracic cage. When you inhale, the diaphragm flattens. So when the diaphragm flattens, you are contracting it and you inhale. When the diaphragm relaxes, it goes back up to a domed-shaped position and you exhale. And this is the reason why the action of the diaphragm is in your hit list as the prime mover of inspiration. I also said that it is skeletal muscle and it is voluntary. It needs to be innervated by somatic motor neurons. It is innervated by the phrenic nerve. The phrenic nerve comes off of regions of your cervical spinal cord at levels C3, C4, and C5. Our little rhyme is C3, C4, C5 keeps the diaphragm alive. And that helps us remember that those are the levels of the cervical spinal cord that have nerves that are innervating the diaphragm. And here again is another picture of the diaphragm. We can see the white central tendon, and it's domed up by your ribs. That is where the insertion is. And again, the origins are going to be the cartilages of the lowest ribs and the lumbar vertebrae. That concludes our discussion on the muscles of the abdomen.